Number 1,
2,
3,
4.
5.
5,
It's slow.
The role of the yellow wallpaper as it pertains to mental health treatment of women from the late 1800s to today's modern society, and particularly to both medical treatment and society to postpartum health. The yellow wallpaper has played an incredibly significant role in mental health advances for women in both modern times and in today's times. It was written in 1892 by author Charlotte Perkins Gilman. The novel takes on what happens when a new mother is told in order to cure her mania, she must be forced to do what is called the rest cure. The rest cure was strictly enforced regimen of 6 to 8 weeks of bed rest and isolation, without any creative or intellectual activity or stimulation, from nerves to neurosis. This was not an uncommon treatment during this time. In fact, Charlotte Perkins Gilman was inspired by this because of her own experiences after having a child and being treated in such a way that caused her to want to write this story. The yellow wallpaper explores real madness that is created when a woman is isolated and left in her own thoughts during an already difficult time. When a woman has no outlets, she begins increasingly focusing on the wallpaper until she finds herself in a true state of mania. This is one of the main themes explored, mental illness and its treatments. This novel was intended to open the eyes of the world. What the author hoped for was that no one else has to endure the same treatment that she underwent, and to encourage physicians not to use it. She even went so far as to send the story to her physician, Gilman. In today's society, during the time the book was published, females have been able to relate to the narrator's mental health illness and treatment in the yellow wallpaper. The novel really kicked off a change. Since it was published, there have been great advances in the mental health field. There are still issues, and people with illnesses are often ignored and told to shake it off. For many, the subject of mental health is taboo and also often goes undiagnosed. The lack of public mental health awareness may be due to the thoughts of the people from the 1800s. In the past, women were thought to be more susceptible to mental illness because they were seen as a weaker species. We now know this is not true. In the case of women after birth, it can be particularly difficult because of the strong hormonal changes in the body. What comes to mind to many is the Tom Cruise versus Brooke Shields debate from the mid-2000s. Tom Cruise being the one who did not believe in medications, while Brooke Shields defended the use of medications in mental illness. Shields even claims that medication was the only way that she vitally was able to help cope with her own postpartum depression. This is not only an example of a still current debate of medication, but also a male claiming to understand a female health issue. Even with advances in society understanding the extreme effects of birth to the female body, there are still those that choose to ignore it. Every cure has its own view, but in the U.S., the words "pick yourself up by the bootstraps" are way overused. What has changed since 1892 is the doctors have a better understanding. In the story, the narrator has all control taken away from her. She secretly has to write at night in order to express herself in the few ways she is able to. There's a clear conflict to modern readers and one that is being related to in today's society. The narrator is not illogical in the beginning of the story. She seems credible, and despite what she feels would help, she defaults to her husband's opinions. She does what many have done and takes the advice of the physicians in her life, both her husband and her son. Her husband takes on her treatment, which she acknowledges may be the reason she's not better. She internalizes internalizes her recommendations and consciously confirms that this medical treatment is okay. Gilman. I sometimes fancy that in my condition, if I had less opposition and more society and stimulus, but John says that the very worst thing I can do is think about my condition. I confess it always makes me feel bad, so I will let alone and talk about the house. Gilman. The narrator justifies such rationales even though it comes through in the story that she truly knows in her subconscious that this is not appropriate. Therefore, her condition worsens as she loses what sanity she has after honing in the actual wallpapers on the walls. The story itself is not particularly having a happy ending, but it is one that appears to have helped create better endings for the world. The narrator may have suffered, but thanks to the story, it brought light to negatives of this treatment. What can be inferred from the story is that the narrator was suffering from postpartum depression. Postpartum depression and psychosis has now become a common issue. In the medical field in today's society, it's considered a common disease and is mostly talked with postpartum women. The treatment that was given to the narrator is also contraindicated now. The literature in the yellow wallpaper has been used in a positive way to bring awareness to society and to educate medical personnel during their training. Treating patients in any form of rest cure would be seen as a form of patient abuse in hospitals today. This treatment is unethical in the times that we live in and could even result of revocation of license and or felony charges if implemented in today's society. While the yellow wallpaper was written in 1982, the modern version of the Hippocratical Oath was written in 1964 by Louis Lasagna, the Dean of School of the Medicine at Tufts University, Shield. It took 72 years to even have an established oath made by medical physicians to make advancements to do no harm. As an important step in becoming a doctor, medical students must take a Hippocratical Oath, and one of the promises within that oath is to first do no harm. Schmerling. In conclusion, the yellow wallpaper has clearly helped to advance medical health treatment. The story itself was a first step by starting a conversation. What's the right treatment and who should be responsible for your treatment? It may have seemed slow, but treatment went from locked away to medication to various forms of therapy. There is more of an influence on patients' feelings. Gilman points out in her work that the narrator knows that this is not what she needs. We now have protection for patients undergoing treatments, including restrictions on restraints, chemical medications, and an oath to do no harm. Therapy is encouraged, and expressing yourself in various forms is widely used. All in all, society is more open to mental illness and no longer treats women medically as if they were weaker. Due credit should be given to Charlotte Perkins Gilman for taking her own negative experience and using it to change the future of mental illness treatments. Thank you.
Wait, do I say all the numbers?
1,
2,
3, 4.
I'm 5.